afternoon to everyone, and welcome to this session that is entitled Digital Transformation of Long-Term Care, Innovations from the Field. This is an activity organized in the context of the project Laurel and co-organized by EHTEL in the track of Imagining 2029. It's a series of webinars discussing different elements of digital transformation. In this case, today we are focusing on long-term care, and would like to give a quick overview first of Laurel. What is the project Laurel? Probably most of you have not heard about it, and I would like to give just a brief introduction of the project. It's a European funded project that aims to help care systems to build better systems for integrated long-term care. And the way we will be doing, and this is during the next 3 years, this has started this year on the month of February, will be analyzing, assessing different systems at local and at regional and at national level, looking at the difference between regions and gender aspects too. And with all these insights, we will produce, and this is the ultimate goal of the project, is to develop actionable policy recommendations and training tools that will be shaped in white paper and training tools. Our plan consists in these 6 steps. We are at the very early stages of the project. We will be first mapping out different elements that contribute to integrated long-term care services. We will analyze innovative and effective service across Europe. We will analyze the context of these innovations and what can help to be transferred to other places. We will make a specific focus, and this is the reason why today we are focusing on the digital transformation on long-term care on the technology side, but it's not the only at all angle where we will be looking at these experiences. We will be looking from all angles around the provision of long-term care services. And as I mentioned before, the ultimate goal is to develop actionable policies that will be contained in this key outcome of the project that will be the white paper by 2020, end of 2026. And it will also be supported with some guidelines and training tools that will support the white paper to make these recommendations wider in the context of policy making in Europe. This is the project. What are the steps that we will be doing? But I think it is important because we are talking about long-term care, and long-term care is a term that can mean different things to different people. And I would like first to contextualize the discussion that we will be having today on the definition of long-term care from 2 institutions, the European Commission and the World Health Organization, which they have, you can see the similarities. So long-term care is defined by the European Commission as a range of services and assistance for people who, as a result of mental or physical frailty or disability over an extended period of time, depend on help with daily living activities and are in need of some permanent nursing care. This is the European Commission. You can see the WHO definition refers again to a broad range of personal, social, and medical service. Here it is important to highlight the point that we are not looking to long-term care only from one sector, from the health or from the social sector, but from the integration of the activity of the different sectors, and also the elements that these services will have the goal of maintaining the level of functionality and ability to have their own daily activities with respect and dignity. You can see synthetically the idea that we are talking about a range of services that are provided to people with long-term care needs, and these services can be at home, can be when the person requires independent living, when it requires assistive living, or when it is institutionalized in a care home or nursing home. So this is the concept of long-term care, what we are looking at today. And we want specifically to look at the innovation side of these services from a technology perspective. And here technology also in a very broad sense, all digital technologies may apply to this analysis. And as objective will be to provide with one example the context from where we can discuss which is the potential contribution of different digital technologies, and also to reflect how we will have to assess this in technological innovation in the context of the project Laurel, and how we can derive from here policy recommendations. The approach is this has the start. This is a webinar in this track Imagining 2029 that EHTEL is doing, engaging not only with EHTEL members, but also with EHTEL friends and with Laurel partners. So we are very happy that you have joined us today in this session, and we will keep contributing from EHTEL to the different activities of the project, engaging our membership, and they are contributing already in other tracks of work, evaluating integrated long-term care with experts on this field.
We are going to share you our project from Central Catalonia, from Althaia and San Juan de Dios Hospital. Here you just have a view about as a global ecosystem we are working on all the work, it requests or we need to do or we have done, to land where we are today, and having this project live, as maybe you don't know, but it's something that is already, working on in the hospital San Juan de Dios. And we are quite happy, to share with you all the work on all the stakeholders on different parameters we needed to explore and to go through to have a systematic map of dependency and chronicity. Can we move to the next slide, please? Okay, here we have the problem, the challenge we faced on the mission. We are in mission not for God, but in mission for vulnerable people. So people living dependency and vulnerability in Catalonia, as well as many parts of the world and Europe, have their informal, caregiving environment, and we have improved their well-being, quality of life, of course, thanks to the fact that health and social parameters and professionals can coordinate using technology and digital healthcare with a collaboration with all the stakeholders involved to give, access to innovation ecosystems on using new technologies on leading to new business model or new business revenue. So what is the transformative outcome on the care provider, hospital, and health and social care organizations are working now together to address and face those problems on needs of dependency and vulnerability. We are sharing information, knowledge, and of course skills to develop effective solutions, as we said, already working in our hospital. So what is the performance on how we can measure? It's a creation of an integrated social and healthcare service with all the elements we need to evaluate or to lead to the value. Case management, shared care plans, bank of supports, products, and occupational therapy service, with a population and territorial based on accessibility by the social service on health, what we call SiSS Manresa. So the added value is that we are working together with the Generalitat and with all the stakeholders, you have on the top of this slide. So Ayuntamiento, Mayor of Manresa, Althaia Hospital Manresa, la social sanitary stakeholders, University of Manresa, and el Institut Catalán de Salud también, the Catalan Healthcare Institute. Next slide, please. So we have, as SiSS Manresa, an integrated health and social service model, and we have developed a unique way of using technology to improve quality of life at home, standard of care, what we can also call or new as hospital at home. Next slide, please. So what are we doing, or what is unique with the model? It's the carer with their own individual home care process, single PID prioritization consensus on closure of the single PID always at home, and the voice of the citizen is also present on all the governing authorities that are involved with vulnerability people management, experience of the patients. We are using all the new technological and digital tools that can improve patient experience, and also, of course, artificial intelligence to get a predictive support, emotional recognition, and other helpful tools that IR prediction can give us, such as predictive medicine, which is personalization of each treatment. Expert people at home for the patients. Yes,
similar the experience, the patient experience, no, is the new concept. Is the expert, the person at home. It's very important. Arrive to the people, the city is necessary. The model, no, is the experience now. History, the persons is very important for have the opinion or the suggestions, the progress, the new.
Yeah, well, I mean, yes, I got it. No, patient experience, of course, for predictive model, it's very important, and it's something unique and quite innovative that we are now offering in Catalonia, but we also want to offer all over Spain and Europe. No, correct? Okay, and we are also using a process platform that is giving us, the ability to show and support activities, relationship with the patients, and it's a way on a process to collect information that is very important for the future.
Es importante todo el proceso, no una
Yeah.
cosa puntual.
Yes, on the platform, we have a global overview of all the process from the patient entering until the patient is completely treated, or whatever will last the treatment or patients vigilance or watching patients, in his own apartment. We have a monitorization of the full process. Okay. Yes, and so the next slide, it's, this slide. So here, you have all our partner, technical partner, or institutional partners that all together, are offering all kind of technology from.
Aquí tenemos el software que garantiza el proceso y toda tecnología conectada.
See, Alexia is a software that can offer the technology, and all over, you have all the partners helping us, providing, a perfect patient's solutions and technology at home.
For example, seguridad del paciente con inteligencia artificial.
For example, to give, predictive medicine, we're working with artificial intelligence.
Recogida de datos de niveles de CO2,
Sunshine Oxygen is, of course, giving us all the information about patient empowerment of the patient inside this kind of environment, and then outside, if there is a difference of behavior.
Telemedicine.
Zenetia, it's offering us, the telemedicine, telemonitoring.
Comunicadores inteligentes.
Liberia is a solution of intelligence communications.
Y todas las constantes vitales, todos los.
Revita is giving us all the clinical background, clinical history of the patients, everything that is going from diagnostic imaging. We can have a global single solution, harmonization of all the patient data, which is something very, very important and quite complex to achieve.
Tenemos una cama robotizada.
Yeah, we have also robotized video looking at the patient and giving us that kind of course change of movement and giving us, you know, patients view or patients walking, whatever. If there is any rings of falling, something that is different, the behavior that's used to be. So with this kind of intelligent system of video, we can assure, you know, patients, I mean, good wellness inside our environment.
Y tenemos también una ducha inteligente que se adapta.
Yeah, we have also what we can call an intelligent, a smart shower that is adapting according, you know, to patients' size.
Sí, se adapta al paciente, controla el ciclo.
Yeah, it's a shower that is adapting to patients' kind of washing or whatever. So we already have put in place a complex but complete environment that give us and gives the patients full services.
Y aumenta la seguridad del paciente.
Full services to of course lead to full patient security.
Y después tenemos análisis predictivo.
Of course, we have predictive analysis.
Podemos predecir la evolución de la persona.
Podemos as we can with the that we got have an information about what's going to be sufficient in the coming days, and if there is any risk of something different.
Bien, podemos predecir toda la sociedad para obtener qué recursos tenemos que saber.
We also can estimate with those tools what kind of resources we might need to have a good patient management in the future.
Y tenemos también con inteligencia artificial un portal del cuidador, que hay una parte que pone para cuidar y para cuidarse.
And yes, on our platform dashboard, we have both information for the patient that is giving the care or the caregiving treatment, but also for the patients to understand, you know, what is going on.
Y dentro también tenemos cómo recoger estas historias de los pacientes, ¿no?
Yeah, and of course the software on the platform is giving us the opportunity to get and to collect all the data or patients' data that are needed for the future.
Y ahora vamos a verlo unos cuantos en directo.
And right now we are going to see a short video of how it works, what kind of solutions we are giving.
Tino, ¿podemos compartir nosotros la pantalla?
Sí, pots provar-ho?
Sí, has de deixar de compartir tu?
Sí.
Vale, i ara jo comparteixo. Em sembla que...
Ara pots fer-ho? Pots fer-ho ara?
Sí, ya está. ¿Vale?
Perfecto.
Por un lado tenemos el software Alexia.
This is the Alexia software that we are presenting.
Formato web y formato aplicación.
We got it in of course, on web platform, but also as an app.
Tenemos nuestras personas atendiendo en casa.
This is all the information that we are collecting to give, caregiving for the patients at home. All the information that we are collecting, you know, are there. So it's a complete information about the patients, about where is living, clinical data that are needed. We finally offering a full harmonization of patient data.
It's very important the relationship.
Yeah, and of course with the patients, you know, main contact or family contact.
Social data.
And then after all the social or economical data regarding patients.
Hemos integrado los dos sistemas, salud y social, con toda la información. Esto es una de las más diferenciales.
We merged the two systems, I mean, clinical data and social data about the patients that was quite complex and unavailable, I mean, anywhere in Europe. And we have a cosmetic view on the dashboard, all the evolution about, you know, patients' evolutions and what is going on. We can have personal patient plans, how we need to care on the same things. We can give instructions to the people that are giving care to the patient of what is about to be done.
Esto es otro hecho diferencial. No solo hacemos un plan de una persona, sino también del cuidador. Cuidamos al cuidador.
This is also a unique difference about the systems. We are not only making a patient plan, but also offering what the caregiver has to do according to the data that we are collecting. So this is also unique. And of course, according to the clinical data that we have on information that we previously collect, we can clearly organize the patient's, attention, what is needed, personal hygiene, and all this kind of information that are needed to attend perfectly a patient at home and this is very important to understand, the global team of people that are attending patients and also where they are and who they are for the other caregivers. So they have a complete 360-degree attentions or caring view about what is needed for the patient and who is who.
Incluso todo tiene un coste, nos hace el presupuesto de todo lo que costará la atención de esta persona.
And it gives us the global, budget of caregiving for the patient, meaning what's going to be the budget, complete quotations for every people needed to give care to the patients. We have access to all the vital signs, patient vital signs from remotely on automatically. We have patients own alerts according to what is needed. We have access to alerts, or we're providing alerts. We have the right people, to be connected to those alerts and to give the correct, care or patient's attention that is needed. And this is a dashboard or kind of information we are offering to be sure that everything, is controlling, is under control. Yeah, what kind of patient activity and everything that you can imagine, and of course the quotations. Also, we are giving the patients and patient's family a monthly quotation estimations of what are going to be the patient's needed budgets to be treated according to the technologies that we're offering. And of course, the social part, caring for the patients is also getting attention to be sure that the patients have a correct food alimentations, also integrated.
El sistema de monitorización a domicilio por inteligencia artificial.
The monitoring patients at home with artificial intelligence. You can see in real time what kind of dashboards that we have access to for every patient's apartment or hospital room where they are attended. We facial
The movement.
Facial on patients' movements that can give us until emotional feelings of the patients.
Is identify the person is in the bed. Right? Is that if the possible the problem in the person, the alert in the nurse or in the family on the professionals. Alert. The person that has problems is the risk falls is very important. The control and monitorize in the person is the person, for example, at home the person no movement. Artificial intelligence detect that the no movement in the person are active in alert in the family on the professional is very important that the prevention, the prevents the model. For example, is the blue.
Yes.
Is the person attend for the professional. Is the color blue. And artificial intelligence identifies either color, either different professionals, a different family or different persons.
This system is monitoring in real time patients that they are in their own rooms, either if they are at home or they are in a hospital. And this is through sensors and artificial intelligence, is to prevent falls. And they have achieved 85% of fall prevention with this system in place. Someone was asking, what does it mean, this report caiguda? It means reporting a fall. So maybe the question for you, Bartomeu, is who is hitting the button on this reporting a fall? Is the professional, is the family, the caregiver?
Family on physicians, on professional caregiver.
Pasa que los profesionales tienen todo cuadrado.
Of course, the physicians, we just saw before, have a complete dashboard about patient information, just such as vital signs and all these kind of things that are real-time monitorization. In this kind of example, the person is sitting. If we have created an alert telling that the patient cannot be seated but remaining, lying at bed, we'll have an information in instant time, in real time, telling us that the patient needs to be in sleeping position. This all work with videos that is not recording. Recording as a video, but just as a technology. This video offers us the opportunity to connect on C when needed. The importance of gravity. We can, of course, choose what kind of alerts you want to put in. If the patient, doesn't move, if the patient doesn't want to eat, if the patient doesn't go, to the lavatory, all these kind of things, we can create alerts so we can be sure that the patient, daily requirements or daily caregiving are connected to caregivers on are operational for the patient. Yeah, we have created a channel just for the people that are giving, patients care. Yes, the artificial intelligence then, according to the information that we got, from patient history, patient at hospital, and all the information that we are collecting, is giving us, what kind of hygiene, what kind of daily minimal behaviors the patient needs, and it's directly creating with an algorithm, taking data from what we learn from the patients, because we are collecting a lot of patients' data. We are giving patients empowerment because we can get patients' feedback about how it feels with the use of the technology, on the results or the level of utility that all these technologies are getting a better patient's quality of life, a better end user quality of life.
So there's a couple of questions that are about whether this is a pilot or whether it's a system that is working in real life, in real time.
Yeah, it's a real-time system, and we have access, in real time to patient informations on any kind of data that we are processing with the technology. It's not something we are giving every 10 minutes, 15 minutes, 1 hour. It's real-time information that we are providing to the caregiver and to people and family.
And it's used as a standard way of giving care to people.
Yeah, this is what we think. This is why we think that is unique, because the Alexia software we're using is on all the partnerships that we have made with technological providers since many years. Bartomeu and his team are working these projects, giving us the opportunity to have real-time patients information. Está en tiempo real todo, no?
Todo en tiempo real.
Everything is real-time.
And numbers-wise, how many people benefit from the system? on average each year, perhaps?
Al día de hoy, ¿cuántas pacientes ya tenéis bajo control? Sí.
42.
At present time, as a proof of concept, we already have 42 patients under control. So we are on the proof of concept stage, but we have 42 rooms that we can monitor and get complete clinical patients data.
Okay. So I think there's a linked question then, which is, are you going to try and replicate this approach in other hospitals in Catalonia when you get the evidence?
Yeah, this is a good question, and this is where the region of Catalonia is supporting the project. So of course, what they need, before to offering, this kind of new software or technology to all vulnerable patients of Catalonia is being sure that are using is giving correct information. All the artificial intelligence we know are working with algorithms that are taking patient data from the past. Because we know this is some things that we would like to export to be sure that other countries can benefit of such patients monitorizations. The main idea is, of course, to export outside Spain, this new model of patients at home or hospital at home.
We've got questions that relate to what you've just said vis-a-vis the economics and current budgetary constraints, and whether you've got a sustainable business model for that.
Yes, this is a good question, and I understand completely. What people are looking at. What basically we want is to be sure that we can provide strong guarantees to patients, family, patients, organizations, countries that what we are offering on starting today is going to be, tomorrow patient monitorization. So that's why in Catalonia we are going to be at 200 patients and central Catalonia and Manresa. We're going to have, at end of 2026, 200 patients under connections. But the software and the system is already certified to be used by, other community on government or whatever if it's needed. It's a complete pack. So this is something that have to be discussed with Bartomeu and its team. But according to my own experience as a digital person or digital healthcare person for many, many years, this is the first time that I saw such a good social empowerment tool that is providing data harmonizations, good patient motorizations, and also providing solutions, not only alerts, but also solutions for the future.
So a question about assessment and evaluation, and then a specific tool. Are you assessing and evaluating what you're doing? And in particular, do you recognize the tool, the Residence Assessment Instrument, or RAI? Do you use that? Maybe our colleague Luc Nicolas might like to come in there.
Yes. It's basically to define the needs of long-term care. Basically, where you before design actually is to define the care plan, and that's an international instrument which is used by quite a number of European countries, and to support the design of care plan and their interactions of all the people in social and healthcare, which need to support the quality of life and the care plan of the person. So my question is the tool connected to some kind of global assessment, standardized assessment, which provide indeed a framework to design.
Okay, I'm going to try to translate this in Spanish to Bartu to be sure I can give you a good answer. But first of all, I want to be sure that I correctly had understood your question. So your question basically is how do we assess this technology on if there is on if we are working on if a global technology assessment with existing assessment tool for social caregiving?
Yes. I mean, I'm asking correctly if you are aware of this instrument, because that has been the starting point for many policy development in European countries. That's the tool which has been used as a base. So I'm just asking if you have used that or if you have been inspired by that in developing the tool. The RAI, Residence Assessment Instrument. It came from the US and then has got a lot of EU developments.
So yeah, maybe that could be a problem, but they have designed a global new concept without not having a look, but understanding that what was already existing for this kind of population or patient populations, vulnerable patients, were not, giving the right solution or not choosing the right technology. They just have designed a complete new model, so they didn't really look back at what was there or try to connect their own system with the existing ones.
Yep, thank you very much, and thank you, Bartomeu. Actually, I really like the presentation and the solution that you presented. It sort of touches a lot of points that we are trying to make sense of in terms of trying to evaluate or try to consider whether those things are good. So actually, your presentation sort of, on the one hand, consolidated some of the ideas that we'll try to advance in order to systematize the evaluation, performance evaluation of different digital solutions. But on the other hand, also raises questions that I would give them back to you. So I think this was a really good starting of the session, and I think we will be able to do something. But in any case, I would just raise some ideas. I don't have a lot of slides. It's just raising points, presenting some of the ideas that we're having on part of Laurel in the project in terms of this digital evaluation of health-related tools. So let's see. Let's start with what we are looking for when we're evaluating technology. So the first thing that I suppose we need to understand is our final goal is to see what works and what doesn't work. So one of the things that I was surprised with your solution is that it basically covers all the aspects that can be covered in a long-term care. So from monitoring of the patients to coordinating teams to giving support and care to the patients, the dashboard, so that's the visualization of information, collecting information, decision support. I really like the three pillars that you presented at first, if I remember correctly. The first one was try to extend the environment of care around the patient, if I understood correctly. The second one was try to push somehow the use of new solutions to facilitate different procedures around that extended care environment of the users. And finally, of course, the platform that supports all of this. So my first question or my first concern when hearing you and everything that the platform does, that the solution does, is how do you know or how do you assess which specific parts of the solution works and which of the parts don't work so well or need more or less improvement? All right, so that's the main reason why we need, or that's what I'm written there, that we need a procedure, a methodology to evaluate the performance of, and that's what I wrote there, of either the systems as a whole, solutions in more specific ways, tools or technologies, and so on. So the first question there that I raise is it possible to carry out this evaluation of system solutions or tools technologies in isolation? So as a whole, can we say, okay, okay, I didn't get the name. The whole solution you presented, can we say definitely it works or it doesn't work, or we need something else. We need to have more granularity and go into the subsystems, the solutions and technologies using there. I mean, getting more into details of what's being implemented. In any case, if the answer is yes, of course, we can go through different existing assessment technologies here. I think the way I'm using assessment is not the same as Luke, I believe it was talking about. That was assessment of patients, if I understood correctly. This assessment of technology. So just validation and performance assessment of the technological solutions. So we can use any of that. Let's think on top of my head, the TRL or the acceptance level or something like that. If the answer is no, and of course we want the answer to be no, otherwise we wouldn't have anything to do in the project, or maybe not, or we're not so sure. Should we put in context the different elements of the technical solutions somehow to facilitate that assessment? So let's try to make that exercise of a potential framework that would support this technical performance evaluation. Yeah, next slide, please, Tino.
Yes.
So this comes from a couple of different overall frameworks on long-term care that we've been reviewing. And the first thing that occurred to us is, okay, let's see if we can separate the different intervention areas that are involved in long-term care and see if it's easier to look at what the different technologies are when looking at the main intervention areas, these main intervention areas. And second, if it makes sense to look at performance assessment when looking at these areas specifically. So we can have, or we identify it just as a starting point. This doesn't mean that we already are going for this. So we have information and research. We have the service delivery, which is, again, this is not purely technical things. This service delivery could be anything that was talked about in the previous presentation. We go to the highest level, so leadership and governance issues. We have, of course, the workforce, that the professionals, the caregivers, the informal caregivers, and so on. We have something that I was really surprised to see in your solution, which is the financing part of the caring. So again, it also is a pleasant surprise in the sense that it hints at the fact that maybe some part of the technology can be used to support financing operations of ILTC at different levels. We'll see that one. And then we have, of course, this is usually considered in isolation, the technologies and medical products. And all this, of course, goes around, as we were seeing, around the individual integrated long-term care user and its own particular environment, as we were saying. So the first question was something that I pointed out before. Does this make sense? We can now, or at least in my mind, I'm able to put technologies in more specific, smaller boxes, each of them in their own intervention areas. So the question is, would my assessment of the performance of those technologies be affected by in which area are they doing? I understand that the objectives specifically of service delivery are not, of course, the same specific objectives of the financing area. So those difference in objectives is something that should be considered when I'm evaluating technologies that are addressing these different areas. So I will leave that open so we can do that in the discussion. So please, the next one. Yeah. So going more into detail and focusing on technology. So the first step would be, okay, let's take a look at what kind of tools or technologies or solutions could fix in each of these intervention areas. Let's talk about technologies or at least applications that would fall into each of these different areas. So for information and research, of course, we will have clinical information systems. And here we will have things like the electronic health records, we have the portals, and there's one aspect that is there that, well, it's not really a technology by itself, but it's a characteristic of the technologies that must be fulfilled by anything that is coming here, which is the interoperability. One of the questions that I put in the chat before when I was reading that is that I understand that the solution of Manresa is limited to let's call it one hospital or one single community. So if you were to try to integrate or expand the solution to consider another hospital, one other entity or association of caregivers, how easy or how difficult would it be to make data shared, for example, between those things, the interaction between what you see in the dashboard, collecting information for another entity or association or hospital, and so on. Okay, in the part of the service delivery, we can have two things there, right? One is one could be considered related to one of those pillars that you mentioned, like extending the environment of the care, and seems to be one direction in which we should be aiming to go, which is the self-management support, which is giving more power to the users and to the patients to be able to do more things by themselves without relying always on experts. So what are the kind of technologies that are supporting that self-management? So we have, of course, the personal health records. You should be able to access those and should be able to see what the professionals are recommending you to do and so on. You also have the mobile health applications. We have telehealth applications. We have, of course, communication understood as interaction between the different patient, healthcare professionals, caregivers, experts, and so on. And of course, we should be talking about what technologies could improve the engagement of the user. Again, one problem that we had with another project in which we're working with a similar dashboard for, and that was only for healthcare professionals. It was that even though all the information was there, the way we were presenting the information to them and the way we thought they could perform the different operations there, they didn't like it. And therefore, very quickly, they stopped using it. So how do we avoid this? What are the different things that we can do to try to maximize the involvement of the different users, right? So going to leadership and governance, of course, we have the policies. That's what Laurel is about. We hope that in the end, we are able to have as outcomes of the project a specific policy and recommendations on how to advance on different things here. For the workforce, again, this is something that I found really important, and I like also that part of the portal where you have those videos for the carers, right? So we're talking here about e-health education. There are many people, and I can count myself as one of those, that I don't know so much how the health system works. And if I was asked, actually, you could actually do a lot of the procedures yourself, I wouldn't be able to even start doing that. I don't have the information. I don't have access to the information. I wouldn't even know where to look for that information. So that's something that should be happening. You were also, or we are always talking about putting devices to the patients, right? Where a wristwatch, we will be able to monitor your health parameters, or just enter information in a portal through your or through your mobile phone. So what's the level of digital literacy that is required to do those things? Should we do, or this is not a question. We should be trying to push educational tools in order to make the users more, first, aware of what is available, and second, once they know what is available, if we're making them use specific devices, then also helping them to understand and use them. And then in others, that was the most of technologies, but here what I put probably is more, I say, umbrella type of technology. So again, when we talk of artificial intelligence, that's extremely broad. I can see artificial intelligence, certain things being applied to each of these boxes. If we were to contact an Amazon or a Google and say, okay, we need to process this kind of data to reach this type of results, then we would end up with 6 different tools. Again, we also have other things such as augmented reality or telemonitoring or remote monitoring, which in any case seem to be specific technologies that could support the other intervention areas. Yeah, okay. And there's another dimension, right? So what we were looking at before was more, at least in my mind, what is the current state? What is the ecosystem, or what is the environment of long-term care, and what are the areas in which technologies could have a role? There's another dimension, which is the temporal, which is what is the model of care that we're looking for in the immediate future or in the end. And again, I like what you said about that, extending the care environment around the patient, because that goes very much in line with what seems to be the trend in caring, which is one, giving more resources to the patient so he can manage individually, and also try to involve more elements of the community so that they all support the different caring procedures. The ultimate thing would be that the population at large would be able to self manage a large part, at least, of these caring processes. So again, the time or the timeline is also something that we should be consider when talking about technologies. Again, we're talking about remote monitoring, we're talking about a camera at home, we're talking about domotics. Do we evaluate domotics at the stage of technology and development that they are now? Or should we start looking into what is the potential, or what we're seeing that is still in prototype stage, but we know will be there in 10 years, that would enable a lot more things to happen?